So let us talk about Kaphaja Grahani. Kaphaja Grahani, what does the patient come to your clinic? If the patient comes to your clinic, if a patient of irritable bowel syndrome or any disorder comes to your clinic, how do you identify him as Kaphaja Grahani? There are almost few cardinal symptoms with which you can identify the Kaphaja Grahani. Minor symptoms like bloating, indigestion after food, he feel like gas filled stomach, and all those minor Kaphaja Ajirna symptoms will be there. But the main classical symptom, cardinal symptom that differentiates Kaphaja Grahani from Pittaja and Vataja Grahani is that the patients will have repeated stools of normal to semi-solid consistency. The patient will have repeated episodes of stools of normal to semi-solid consistency. And number two is the most cardinal symptom. The patient will never feel satisfaction after going to the toilet. He always feel there is some left out, or there is some residual mala that is present in the stomach. So that is the important symptom of Kaphaja Grahani. Number two, stools will be mixed with mucus, stools will be mixed with froth, or stools will be mixed with saliva like watery substances. So this, number one, the patient is having repeated stools of normal to semi-solid consistency, number one. Number two, the patient is having repeated episodes but no proper satisfaction of evacuation, number two. Number three, stools may be mixed with mucus or froth, that is number three. Or mucogelatinous substances, something like that. So these three symptoms differentiate Pittaja Grahani and Vataja Grahani from the Kaphaja Grahani. Now, why does Kaphaja Grahani occur? It is a beautiful topic and it has a beautiful reason. Now you go to West, you go to European Union, you see their foods. Their foods will be containing a lot of maida. They'll be eating more bun and bread and all stuff like that. Dessert. They will be eating shitala ahara like desserts, ice creams, etc. They will eat guru aharas. They will eat snigdha aharas and oil fried foods, etc. But that will not cause excessive problem to them. Why? Because the people who live in European Union live under constant state of Hemanta Rutu, extreme winter. So in winter, in Hemanta Rutu, the Agni is said to be at peak, the digestion is said to be at peak. Whatever you put inside stomach, whichever poison you put inside stomach, whichever heavy digestible food you put inside stomach, the stomach will be able to digest it because of the existing climatic conditions of the particular country. So their food does not disturb them. Whereas you go to an Indian restaurant, you order 2 parathas and a butter chicken or gopi Manchurian, and then finish it with a dessert like kulfi or an ice cream and come back. How do you expect a normal bowel evacuation the next day? The patient will obviously end up with Kaphaja Grahani. So intake of excessive guru ahara, snigdha ahara, shitala ahara causes this, number one. And now people are crazy about all those keto diets, etc. Anything you can take only oil fried foods, oil fried chicken, oil fried vegetables, oil fried eggs, oil fried everything, definitely will end up in Kaphaja Grahani. Those keto people have chronic irritable bowel syndrome. It is one of the most common side effects of ketogenic diet. The stomach upset is one of the major problems of ketogenic diet. So you have excess of all these foods, definitely will end up with the Kaphaja Grahani. And Kaphaja Grahani, minor symptoms like bloating, ajirna, etc. will be there. Major symptom is that repeated stools of normal to semi-solid consistency, improper bowel evacuation and not feeling satisfaction. Stool will be mixed with mucogelatinous substances and froth. That is the cardinal symptom of Kaphaja Grahani.